Welcome back to another video. Today we're going to talk about subtle symptoms of high blood pressure. Did you know that almost half of adults within the US, 108 million or 45%, have hypertension? According to the CDC, blood pressure is decided both by the amount of blood your heart pumps and therefore the amount of resistant blood flow in your arteries. The more blood your heart pumps and also the narrower your arteries, the higher your blood pressure. Having hypertension puts you in danger for heart condition and stroke, which are leading causes of death in the United States. 1. Red spots in the eyes. Over time, high blood pressure can damage the blood vessels within the eyes. These blood vessels may become dilated or damaged, which creates bloodshot eyes, explains optometrist Dr. William White. Red spots in the eye can occur from momentary spikes in blood pressure, like once you lift an important object or sneeze. But hypertension may create frequent red spots or even bloodshot eyes. Your vision won't be damaged, but the blood vessels are. If these spots continuously appear for 2 weeks, consult a doctor. 2. Fatigue. High blood pressure can make people feel fatigued, consistent with Dr. Guy Almans, Director of Cardiovascular Health and Lipidology at the Sandra Atlas Bass Heart Hospital. This is often common. The upper your blood pressure, the more your heart has got to work, which tires out the body. People with heart conditions, which sometimes stem from high blood pressure, have more struggles with fatigue. Additionally, certain blood pressure medications can cause tiredness. 3. Shortness of breath. According to Michigan Health, shortness of breath is typically the primary noticeable sign of hypertension. Cardiovascular expert Dr. Valerie McLaughlin explained that prime blood pressure strains the right side of the heart. When the heart struggles to push blood, the body receives less oxygen. Many hypertension patients experience shortness of breath after climbing stairs, jogging, or other light exercises. Despite breathlessness being a standard sign of hypertension, many of us misdiagnose this symptom, often testing the heart rather than blood pressure. 4. Excessive sweating. People with high blood pressure are more likely to experience excessive sweating, consistent with medical news today. This is often because the heart is exhausting itself. When the body feels overworked, it releases adrenaline and noradrenaline, two hormones that trigger sweating to chill the body. Ironically, sweating from exercise may additionally help blood pressure. In 2019, British Journal of Sport Medicine released research that concluded that sweaty workouts improve blood pressure. If you're excessively sweating without heat, exercise, or medications, ask a medical professional. 5. More back pain or less. Although this is often not common, back pain are often a symbol of hypertension in some cases, consistent with Michigan medicine. High blood pressure may prompt a sense of pressure or pain in your back. In 2015, a Korean study found that the other was true. When participant blood pressure heightened, they felt less low back pain. Researchers suggest that this might flow from hypolagisia, a lower sensitivity to pain that appears in some hypertension patients. 6. Blurred vision. Eyesight might be an indicator of your blood pressure. Over time, high blood pressure can blur people's vision or maybe permanently destroy it. This is often called hypertensive retinopathy. According to ADA, hypertensive retinopathy occurs when high blood pressure damages the tissues and blood vessels within the back of the attention. Patients might receive a cloudy vision, double vision, or headaches. Within the late stage of hypertension, they could even lose vision. These vision problems only get away when the patient gets their hypertension under control, says Panaccio. 7. Chest pain. The Centers for Disease Control (CDC) reports that chest pain, also called angina, may be a symptom of high blood pressure. Hypertension strains blood vessels, which make the heart work harder to pump oxygen. This will cause periodic chest pain. Preventive cardiologist Luke G. Laffin advises people to hand medical attention if their pain lasts for extended than 3 minutes. It should not be stabbing pain. It might be intense pressure in your chest. If angina accompanies nausea, breathlessness, fatigue, or a chilly sweat, consult a doctor.